How can sickle cell patients avoid drug-seeking stereotypes in the ER? When you go to the emergency room with sickle cell disease, you want to be treated with respect and understanding. Unfortunately, some patients face unfair stereotypes that they are seeking drugs rather than genuine pain relief. This can lead to delays in care and worse health outcomes. To help prevent this, there are practical steps you can take to advocate for yourself and communicate clearly. First, bringing documentation is very helpful. Carry a letter or care plan from your hematologist or sickle cell specialist that explains your diagnosis, typical symptoms, and recommended treatments. Showing this to staff can clarify your medical needs and reduce suspicion. It's also useful to be familiar with your medications. Know your current pain medications, dosages, and any past treatments for sickle cell crises. Being able to discuss these confidently shows that your pain is based on a documented medical condition. Clear communication is key. Describe your symptoms honestly and specifically. Explain how this pain compares to previous crises and what has helped or not helped in the past. If you have a relationship with a sickle cell center or specialist, try to establish care there. These providers can coordinate with emergency departments and help ensure your care is consistent and respectful. Self-advocacy is important. If you feel your pain is not being taken seriously, calmly ask to speak with a nurse manager, patient advocate, or supervising doctor. Remember, you have the right to respectful, evidence-based treatment. Carrying educational materials about sickle cell disease can also help staff better understand your condition and reduce misconceptions. Healthcare providers can do a lot to improve care too. They should receive training on sickle cell disease, implicit bias, and pain management. Listening carefully to patients, validating their experiences, and treating pain promptly are essential. Policies that promote equitable care and hold staff accountable for discrimination are also critical. Addressing stigma in emergency care is a systemic challenge. It requires efforts from both patients and healthcare systems. Patients can take steps to advocate for themselves, but lasting change depends on education, policy updates, and cultural competency training for providers. Connecting with patient groups and support networks can empower you further. Remember, your pain is real and deserving of proper treatment. Do not hesitate to seek emergency care when needed. Always consult your healthcare team for personalized advice, as they understand your unique medical history. You are not alone in facing these challenges, and with the right communication and support, you can help ensure you receive the compassionate care you deserve.